and I am a social work major here at the University of Wisconsin-Oshkosh. And then I have been working closely with the academic support of Inclusive Excellence to plan various COVID-19 community discussions, just to look at how COVID has impacted various marginalized communities and populations. So today we will be specifically looking at how COVID-19 has impacted sexual assault agencies within the area. So we have directors from 3 different agencies here with us today to look further into this issue. So to begin, I would like to ask the panelists to introduce themselves by stating their names, pronouns if they're comfortable in doing so, and then the agency that you direct.
Hi, my name is Kristen Trimberger. I go by she, her, and hers, and I'm the executive director at Reach Counseling in Neenah.
Hi, I'm Nicole Krause. I'm the executive director for ASTOP, and my pronouns are she, her, and hers.
Amanda, I don't see Amy on, so we can just continue with Kristen and Nicole.
Okay, well, thank you all for being here. So to begin with the first question, can you discuss why sexual violence survivors are one of the most vulnerable populations during the COVID-19 pandemic?
Yes, I can. So I think, there is a lot of evidence and there's studies that show that anytime there's a state of emergency, rates of domestic violence, sexual assault, sexual violence tend to increase. I think there's a factor with the stress that just really perpetrators of violence against women, it highly increases during these types of situations.
Yes, and I would just like to add that I believe that sexual violence survivors are already struggling with connection, and this pandemic has made it more difficult for them to connect, and the isolation that it's causing.
So with the big impact that it has had, how would you say the pandemic has specifically impacted your agency?
For us specifically at Reach, so we offer in-person therapy as part of our Healing for Survivors. We also provide treatment to sex offenders. So we have a sex offender treatment program. So right at the onset of the pandemic, when people needed to stay at home, we really had to quickly change our business model from being an in-person business to going virtual. So we adopted a telehealth platform right away in the beginning, which was successful for some of the people that we were working with. However, when you're looking at working with sex offenders, many of them do not have access to the internet. And so telehealth isn't necessarily a viable option. So we were providing counseling for them and treatment for them over the phone in some instances. There's been a lot of benefits to going to telehealth, and that we've removed some barriers like transportation, childcare, things like that. But for a lot of people, it's actually created, a lot of people that we serve, it's created more barriers, and that many of them don't necessarily have a private or a safe space to talk, especially during the safer at home orders. It's very difficult to do therapy when you're trying to have a session and there's other people in the room or within earshot of what's being said. And so currently, now that the pandemic has evolved, we're actually offering a hybrid model. So we have adopted safety practices within our office. So everybody that comes to us needs to wear a mask. We're doing social distancing. We've installed plexiglass in our reception area where people are checking in for their appointments. We've also really heavily increased the cleaning of our office spaces and our common spaces, like our waiting area. I know our therapists are using a combination of like a black light that they're able to quickly put over everything in their office, and then also wiping down with like Lysol wipes and disinfectants. So we really kind of have this hybrid model. So for our clients who prefer telehealth and that remove barriers for them, we're continuing with telehealth. But for the ones that it really wasn't an ideal situation, we are now offering in-person services 5 days a week during our regular business hours.
And I actually don't have anything to add. We're doing a lot of the same things and finding the same situation with survivors. Some of them, the telehealth is working out really well, and some of them are preferring to meet in person. So we are here 5 days a week as well.
Thank you. And then with the various changes that you have made at your agency, were you able to receive assistance to like transition some of these services?
So for REACH specifically, yes, we are very fortunate in that we are a government supported agency. So we do receive funds from local, state, and federal level. And so really we were able to, like I had mentioned, install the plexiglass. We actually have a buzzer system now where people can call from their parking lot. They can get buzzed into the building just to limit the number of people in our waiting area. Another service that we provide is we have advocates that will respond in the emergency room when there's a survivor of sexual assault that has presented in the ER. So early on during COVID, obviously for safety reasons, our advocates weren't able to enter the building and go into the emergency room. So we were able to purchase iPads that allowed us to FaceTime and still have somewhat of a face-to-face interaction with the people that we were serving. We've also been able to do things, so we have an education program. We provide education in over 71 schools in Winnebago County. Obviously, during Safer at Home, the kids were learning virtually from home. And there was a lot of safety concerns just about the curriculum that we provide. You know, we're teaching kids about protective behaviors from a very young age. So we work in, preschool all the way through senior year. We talk about things like protective behavior, but then we also let kids know at an appropriate age that if they are experiencing anything currently, or if they have experienced anything in the past, that they do have safe, trusted adults that they can go to. The concern was with delivering that curriculum virtually, who's in the home? Is there a potential perpetrator that could be hearing some of these listening in on some of these sessions where we could inadvertently create maybe a harmful or an unsafe situation? So another thing that we were able to do with our funding was provide headphones to a lot of the kids. So we distribute them to the schools, and the schools were able to offer a way to distribute them to students. So yes, we were very fortunate in that we did have continued funding throughout the pandemic to help us adjust our services.
And again, I go along with a lot of what Kristen has said. Our funders have been incredibly supportive and flexible throughout local and up to the federal funding.
So just a quick follow-up question for Kristen. Have you seen like kids wanting to be like involved through like the online program?
You know, that's a great question. I do think engagement was difficult, especially for some age groups specifically. I know at this time we haven't been doing as much with the Head Start programs that we typically would work with, because we're not in person, and virtual programming with kids that are under the age of 5 can be challenging. So in answer to your question, I think yes. However, I will say we did have the leisure of having the summer to really plan. So we had Safer at Home, And then our educators were really able to partner with other agencies that provide prevention education and adapt the curriculum to make it more feasible and more engaging for a virtual platform versus in person. And I do think that that helped them to be more successful in the fall.
Thank you. And then I do see that Amy has joined us.
Yes, I apologize for being late. I was on a call. Hey, Kristen. So I apologize.
That's okay. And then if you would like to quickly introduce yourself and then the agency you direct.
Sure. My name is Amy Flanders, and I'm the Executive Director of the Sexual Assault Crisis Center in the Fox Cities.
Thank you for being here with us today. So I will move on to the next question. Has your organization seen a bigger need for services among this population during the pandemic?
You know, I think what we have seen at Reach Counseling specifically is a much greater need for basic needs assistance, which really hasn't always been obviously our area of focus, because we really focus on prevention education, advocacy, and response and treatment. One thing that we're really seeing, especially prevalent in the Latinx community, is that a lot of the folks that we're serving don't necessarily have the documents or the paperwork that are needed to go to like a food pantry for food assistance or to receive rental assistance. They're also not, you know, receiving the stimulus from the government. So there's been a lot of need there, and we have really adopted our programming and our assistance to that. So in the last couple months, we have been providing a lot more gas cards, transportation vouchers, grocery cards. We've seen a big increase in that compared to what we've done in the past.
Would you like to go next, Amy?
Sure, I can. I know you're maybe taking notes. Yes, what we have seen is in the last couple of years, especially in the last year, our client, we've seen it had a 16% increase in the number of services that each client is receiving. So while the number of clients is remaining flat, they need a lot more services, pretty much a lot with what Kristen was just saying. So what's happening is they got the support group and advocacy and counseling in addition to being referred out for other things. And there's just such a greater desire to have additional programming. Also, our counselors might have, for example, in the past, they could have 5 new clients on their calendar in a week, 2 to 3 would drop off. They would cancel. We did not have that in the summer. Everybody kept their appointments that they were coming through. So people not only want service, they're ready for services, and they're ready to go through the healing process that they need to. And we also had some additional money to help people with food and transportation. We've had people who, one quick story, we had one of our clients who was doing really well, but she had to have a surgery. It was a choice, but she had to have some surgery. And then came COVID, and then her husband lost his job because of COVID. And she had been off for medical leave. And so here you are again. So again, we were helping with rent and things like that. So that's just one story. We had another person who, this is horrible, but her apartment building caught on fire. So yeah, it was just awful. And then the place she normally worked was closed because of COVID. And so helping out with all those basic needs, as Kristen was saying, we had a lot of that too, quite a bit.
Thank you. And then Nicole, do you have anything else to add?
Not a lot. I think that they've hit the points that I was going to hit. As the only other thing that we've seen a big increase with is our crisis line. We have a lot more people calling the crisis line. Again, going back to that isolation that they're feeling.
So with an increase of need for services, do you think there are any reasons why sexual assault survivors might not want to seek support for services during this time?
You know, I think that's evolving as the pandemic is evolving and changing. But, you know, I will say at the beginning, and especially during Safer at Home, you know, there was a lot less mobility for everybody, not just survivors. And so I think that really increased the risk for victimization by like, close partners or family members, because you're really in this situation where you're stuck at home. So I think that was very true in the beginning, and also just the fear of the virus. So things are happening where maybe somebody would have been inclined to go to an emergency room or go seek treatment or a forensic exam. They were scared to get the virus. And so that really played a factor in it as well. I will say though, over the last 4 to 6 weeks or so, as things have been changing, we are seeing more people going back into the emergency rooms again. We're seeing more people disclose to us again as we had in the past. Another population I think has been really affected or impacted in regards to disclosing would be children, because with them learning at home, if the perpetrator's at the house, they may not have access to a trusted adult like a teacher, a guidance counselor, an advocate, or an educator who's coming into the classroom. And so we have seen a drastic decline in our disclosures that had come from children in the schools. However, now the kids are starting to get back into the classroom. We are starting to see an uptick in that again. And if I had to make a prediction, I would say, we're starting to plan for a pretty significant increase in the fall once everybody's back on a more regular schedule.
And then kind of piggybacking off that, one of the things we felt when the pandemic hit is a lot of people were told, don't come to the hospital. Remember, they really wanted to curtail traveling to the hospital. So we were very concerned as well that people would take that as don't go in for an exam. So we worked with ThedaCare, and we had an online interview. Our advocate interviewed their SANE coordinator, their sexual assault nurse exam coordinator, to really say, you're welcome to come here. That can just kind of going over it again and encouraging people that if you're in this situation, please feel free to come to the hospital. We're here for you, that type of thing. It's not just, but that's really the message that was out there from these healthcare providers, is don't come. So there's a lot of mixed messaging going on. So we did that kind of thing and just a lot of social media. And again, it did drop down, it started to pick up, but it's gotten very busy in the past couple of weeks. As Kristen said, the numbers have really, we had 6 SANEs just in 1 week in March. And that's a lot for 1 week. You typically have maybe 3 to 4 in a month, maybe 6 in a busy month. But so the numbers definitely are going back up again. And the same thing too with the kids being in school. The Child Advocacy Center just opened back up again a couple of weeks ago. So they are now going to start scheduling. We'll start having more disclosures and things like that too. So.
Thank you. And then Nicole, do you have anything else?
I'm sorry. No, I don't have anything to add. I think we've seen the same things. Our numbers are going up, and our counselors are definitely busier than they've been in a really long time. So I think people are coming back after being afraid to leave and afraid to go out. Yeah.
So I know there was some discussion about the stay-at-home orders. How has your organization seen those orders impact the rates of sexual violence?
So I think some of the points that we've already touched on, for us, we definitely saw an increase in the use of our crisis hotline. In the beginning during Safer at Home, like we had mentioned, we had a lot fewer survivors presenting right at the ER. However, that's starting to pick up. And then the really big one for us was that the rate of children that were disclosing drastically dropped during that time. And again, now that kids are starting to get back into school again, we are starting to see an uptick there as well.
Well, we didn't have the call volume that we used to, but the calls we had were longer and the needs were greater in terms of talking with people. And that's what a lot of folks had said as well, that it was, your numbers might not have been the same volume, but the people were calling with greater needs and concerns than what they typically would have from us. So it's getting busier. Again, our calls went up, but not quite that involved as what we had before.
I would agree with that. We had a lot of regular clients that were calling our hotline a lot more than they normally did. So.
Yeah, that was one thing, just real quickly, one of that my counselors were saying too, is people who had left the program and counseling over a year prior to when COVID started were calling back in for support. And we encourage people to do that. You're not, if you're done, but your healing's not done, feel free to call back, do a touch base. They had quite a few clients, and we're still seeing that. Quite a few clients, past clients, wanting to come back for support and talk and services.
And Amy, I can echo that same thing for Reach Counseling. I know the counselors and even the advocates, because it's the same thing. Once folks are done with advocacy, our door is always open. And I know both of those programs have mentioned that they had people that had transitioned out of the program, that once the pandemic hit, they ended up calling back and just wanting more support. And I think the isolation, again, played a big role in that too, with them not having that social support or even just a connection to available community resources because they were stuck at home. And so a lot of times just wanting a listening ear, someone to hear them. So we definitely saw people coming back to our counseling program and our advocacy program that had already left at some point.
Because the thing too is we're all essential workers. So we didn't stop during the pandemic. And I think because so many people had, the fact that we were here and available to them made it easier to make that call too.
Yeah, that was one of my questions, like to see if you had enough like staff and support for the crisis line.
That's a great question. So our crisis line, yes, we actually use paid staff for that. And we were fortunate in that we did not have to have like a reduction in staff or anything like that during the pandemic. I will say it was a bit challenging and is still a bit of challenging with our volunteer program. So we have paid staff that respond to the emergency rooms, but during off hours, so like in the evenings, during the middle of the night, the weekends, we use volunteers to respond to those calls. And obviously, the panic at the onset and the mixed messaging with the hospital saying, don't come or do come, people were very, very leery about responding to those calls. So that was a bit of a challenge. Luckily, our staff was able to jump in and fill in so that, there weren't any needs that were unmet or anything like that. But that was challenging. And I will say, that continues to be somewhat of a challenge for us. We're really trying to strategically focus on right now, how do we increase our volunteer base? How do we get people feeling comfortable returning back to the hospitals? How do we keep them here with us at Reach?
Well, one of the things that we did, because Theta Care had initially said nobody could come in with them, but Aurora was allowing it. So it really was up to each healthcare system. We went and purchased a phone, prepaid mobile phone that we had at the hospital, so then they could call and talk to the advocate. So the same nurse could get called and say, if you'd like to speak to an advocate, here's the phone. And again, because the numbers went down, it did get used several times and it went very well. Obviously it's not ideal, but it's still an opportunity for them to have a contact with an advocate. And we were able to follow up, and it wasn't too long. I think by the time maybe June-ish, mid-June came along, the hospitals were saying, you guys can come in, an advocate can come in. So it wasn't a long period of time that they required us, that we couldn't go in, and they allowed us to come in. So, but we had the phone available, and Reach used it as well. So it wasn't just us. We had a phone there, and it was all of us used it as is needed. So anybody that needed to talk to an advocate could call.
We experience the same things. We've actually, since things are transitioning a little bit, we have a lot more people volunteering to help out with advocacy. And so I'm not sure if the pandemic is what's kind of helped that, but we do have a lot more people volunteering right now.
Well, with the cell phone, that's great to hear that you were still able to find a way to get the advocates, like the services there.
Yep. It was very helpful. And as far as volunteers go, what we found too is because some of our volunteers are older, so again, they were nervous about going when they were able to come back in. So we kind of let them rotate in and out. And having volunteers is just kind of part of it. You just kind of have to keep that never stops. Just constantly recruiting new volunteers.
Okay, so moving on to the next question. So for nonprofits, development and fundraising is extremely important. How has COVID-19 impacted your agency's fundraising efforts, and how have you been able to adapt?
So I think, one of the main challenges for nonprofits in general during this time, the ones that would host in-person events, obviously that becomes a challenge, and especially when you're relying heavily on the revenue that's generated at those events. I will say Reach was very fortunate in that, in all honesty, I think the crisis and the pandemic really inspired some of our longtime existing donors to give more, or even if they had historically given to like a specific program in the past, a lot of them were very generous and reached out and said, hey, we understand that there's a crisis going on right now and you might need general operating funds just to keep your doors open during this time. And so we're willing to change how we have restricted our funds in the past and really make it more of a donation that supports your general operating. So that was really, really nice to see and helped our agency a lot.
Well, we have a big annual event every year called Shall We Dance, and it's about 28% of our income. And we had already started, it's a year-round event, regardless of being held in October. So we had already gone through the whole process, interviewing and selecting we have 8 community dancers that dance and raise money. That part was already done before everything even hit. So we said, let's just keep going forward. And if we can do it in person, we will, but if not, it'll be virtual. So of course we made the decision it had to be virtual for obvious reasons. And it went really well. Of course, a heck of a lot more work, because someone said, isn't it easier when it's virtual? No, it's actually more work, but it went really well. Of course, we didn't have the same level of income, but we didn't have some of the expenses that went away as well. And people were still very generous and still very caring and willing to help out. So but it's going to continue. I mean, last year was different. This year is going to be different than last year, but it's not going to be a normal year. So I think these are just ongoing concerns that we're going to continue to have going forward, and different ways of fundraising to make it work.
I would agree with that. We did have to cancel our major fundraiser because it was in person, but we've found other ways to raise funds, and our donors have been incredibly generous.
I think there's something with the work that we do. The people who support us, they stay with you. They're not in and out. I don't know if you guys have experienced that, but it just seems people who they care about the mission, and they just year after year after year, they're there for you. And I had one of our longtime donors who called, how are things going? And I just wanted to know how we were doing as an organization and the staff. So they're there with you. It's not fringes at all. So I think that's at least my experience.
Yeah, and I would say the same. I'm new to the organization, not as new anymore, but I started at the end of August. And so, shortly after Safer at Home. And, I was planning on when I got here, okay, let's find out more about their donors, who's given in the past, who are our large donors, who are our longtime supporters. And within a day or two of me being in the office, many of them are reaching out to me to say, hi, we heard we had a new executive director. How can we help? We know the pandemic's going on. What's going on at Reach right now? What do you need? So I do think, like Amy was saying, the longtime supporters, your big donors who care about you, care about the organization, care passionately about the mission, they have definitely been there and have definitely stepped up in this situation.
Well, that's good to hear, and I'm glad that you were able to all still find funding, even if events had to be moved virtually. Okay, so going back to the staff, how have you been able to support your staff and then keep them encouraged during the pandemic?
I think that's a great question, because for us, the majority of the time, before we moved to our hybrid model of offering therapy in person and through telehealth, our advocates have been at home this whole time. Our educators have been remote this whole time. And so and me coming in new, I didn't have the opportunity to have a lot of face-to-face interactions while being in the office. And so communication was really, really important. And so we increased the amount of times during the month that our whole staff was coming together for staff meetings, just to make sure people had that opportunity to connect and to see each other. Another thing that we've embarked on recently is a diversity, equity, and inclusion journey. And that has also really brought our staff together. We've brought in a consultant who does the education with us, does the sessions with us, but a lot of times during those sessions, we'll have kind of like icebreakers, if you will, where we break off into smaller groups where we have a certain discussion topic. And it's helped the staff to get to know each other on a more personal level, and it's led to some relationships and bonding and things like that. So I think the timing of that, even though it wasn't necessarily intentional to coincide it with everything that's going on, has been really, really beneficial because it's brought our whole team together. Even though it's virtually, it's brought us together in a way that's been meaningful and helped us to better build our relationships.
Yeah, we were fortunate that one of the things that I'd done when I came in, I've been with the center over 4 years now, is really updating the IT. And one of the things I focused on was I wanted to get everybody a laptop and a docking station. A lot of people had that, we had not. But yet some of the people were out of the office working, like your prevention, and they still needed laptops anyway. So we had all that stuff done and ready to go in November. So it worked out well, honestly. I mean, it was just like grab your laptop and your cord and head home. And we did the same thing. We had every other day or something, I forget how many days a week it was, just a quick little, we called it the coffee clatch. You just get together like at 9:30, jump on, how you doing? You didn't have to do it if you had meetings or whatnot. So and what I asked my leadership team to do was to be in touch with your people, try to every day having constant meetings. Everything went incredibly well. I am so proud of them. They maintained a very victim-focused and trauma-informed care on everything that they did. Decision they made, everything they did was always with the client in mind. And that's why I think we made it through as well as we did. They just had a great focus. And some of the other things that we've done, we had instituted self-care dollars. Every month they get a stipend for self-care. Every staff person does. And so we said, even though we're in a pandemic, try to come up with some stuff. And so we always say every month, how did you spend your dollars? People were buying like puzzles online and books and talking about it. And the other thing we would say is, what are you watching on Netflix? So we did those kind of fun ways. I need to watch something because, you're sitting at home. So we brought a lot of that fun. We try to have fun anyway, but those kinds of things into it. So every week it was a different kind of question and to kind of stay connected, and got to see everybody's kids and their pets. And so it was kind of nice in that way. We got to connect, but they did an excellent job of getting through it all. And we were there for each other. So I think it actually made us closer. I really do.
I would agree with both of you. I love some of the ideas that you guys have. One of the things that we have found is the flexibility that we've been able to give staff. We have a lot of staff with small children still at home. So working through allowing them to be home with their kids when they needed to be. And everybody has really come together, as Amy was saying, in supporting the survivors.
Yeah, it sounds like you were still able to find like that positiveness within your agencies and also some time for self-care. And how can community members advocate and support sexual assault survivors during this time?
I would say I think a big piece of that is really engaging in education. I think that there are a lot of issues and things that we face at all of our agencies that maybe the greater community isn't totally aware of. And so I would say, as a community, if you see that, that there's things happening during Sexual Assault Awareness Month, or that we're hosting events, or we're hosting professional development, or you come across things like that, take the time to really educate yourself on what's happening in our local community. And then there's always donating not just dollars, but also that time. So, become part of a volunteer group at one of our organizations. That goes a really, really long way to help survivors.
Well, one of the things that I always talk about is everybody can be an advocate. And I don't mean the type of advocate where you go to the hospital with the same, but everyone can be an advocate in terms of, there's so many people out there, less than 30% of people even report that they've been sexually assaulted. And why is that? Because they're scared and they're blaming themselves. A lot of victim blaming going on, those types of things. And I always tell someone, we have it even in our brochure, believe them. What can you do? When someone tells you, What are the things you can say? I hear you. I'm sorry that happened to you. It's not your fault. And then give them the support they need, which is refer. We have all these great agencies that are doing great work, regardless of where you are in the state. There's somebody that's close to you that can provide you with the kind of a professional support that you need. So it's just, and then ending the silence, which is learning more. As Kristen said, learn more about the issues and realize that if you're close to someone, to have that courage to pick up the phone and call us. I don't do a lot of the phone answering, but of the times I've answered, I've had people say, I'm calling for my daughter. I'm calling on behalf of someone else. It's a difficult conversation. So if somebody opens up to you and says this has happened to them, you don't getting into questions, say, I'm sorry that happened to you. I believe you. And here's some support I can provide to you. That's really what we want people. That's what being an advocate is just being there for them and helping them get the support that they need.
Nicole, do you have anything else to add?
No, I'm sorry. I'm the shy one here. So no, I would go along with everything they've said, volunteering with the local agencies, donating time and money is, of course, and then just believing your friends and family when they tell you that something's happened.
Yes, there are definitely many ways to get involved and become educated on this issue. And then, what are actions that need to be taken at the state or federal level to support sexual assault survivors during the pandemic recovery phase?
This is a really tough question. I actually had a conversation with my staff about this, and one of the things we talked about is we need more mental health. We need it more accessible, and we need it cheaper, more inexpensive, affordable, I guess would be the better word. Continued support for telehealth. If there's some way that making a safe space for survivors to talk, where they're maybe not in their homes, or they can somehow have a conversation without just creating that safe space for access.
I would agree with that as well. And, you know, I think obviously on the state and federal level, the funding piece is so important to the work that all of our agencies do. And so that's where we need to be staying on top of current issues and what's happening at the state and federal levels, so that if we need to be making calls to our local politicians, or if we need to be taking action or signing letters or signing petitions, that we're aware of that to keep the funding that we all receive in place so that we can continue to provide our services.
Well, one of the things that I've noticed, and people said this has happened for decades, is when you see any kind of funding that comes down from the federal level, they always talk about domestic violence, but they do not include sexual assault. And that's been ongoing for decades and decades. This is the first time that they've actually mentioned sexual assault in the dollars and the recovery funds that are coming in. So I'm very hopeful that maybe something will be coming of that. We have a statewide organization called the Wisconsin Coalition Against Sexual Assault, and they have people there who watch all of this and help us out. Like, we've signed this letter, that kind of thing, call your local congressman, your senator, that type of thing. So they help us make sure that we're understanding what the issues are. But I agree, there isn't enough mental health care support out there. I was talking to somebody who works, because if you talk to any of the mental health providers in the community, they're all saying the same thing, that there's a lot more people in need and that the services are going up. And what we're finding is that people aren't looking in that referral. People are needing the highest care possible, and we just don't have those resources. They just aren't here. We don't have the highest level. We have them, but they're way at capacity. So I think we need to take a look at, because it's like a upside down funnel. A lot here, and the closer you get up here, it's fewer and fewer people, and people are entering way up here. So we've got to take a look at the system itself, and how can we make it more accessible for people, and how can we have more people trained to help those who have had trauma.
Do any of your organizations collaborate with mental health organizations in the area?
Well, we are, the difference, the thing to keep in mind is that our counselors are trauma. So trauma is different than other types of things. So when you go to school, there's two paths. One is like a marriage, family, school counselor, and the other is trauma. So there's certain people, we get a lot of referrals from other people in the community. When they have somebody who's had sexual assault in their past, they know to contact us or reach or anybody. We all have those connections because you want to make sure the person who's helping you is experienced in working with somebody who's dealt with trauma. So that's first and foremost. And again, there aren't as many of those, right? So as we were just saying, there aren't as many people who are skilled in that can handle those who have had trauma. So that's a big piece of it as well. But yeah, there's a lot of collaborations going on. We collaborate. We don't do aorta, but people may have aorta issues or they may have depression issues. So we refer as well. So there's a big, huge referral network that goes on so that all of us know each other and make sure that the client is getting the absolute best that they need. So that does happen, of course.
Thank you. And then is there anything else you would all like to add on how you guys have been impacted due to the COVID-19 pandemic?
I think I'll just say I am so grateful to be a part of this panel, and thank you for having me here today. One of the things we might not really think about is the impact of COVID on survivors. The pandemic actually in many ways really closely mimicked what it's like to be a survivor of abuse. So that lack of control, the isolation, there's a lot of very similar characteristics between the two. And so I think as the pandemic continues to evolve, it's really important that our communities are having the discussions that we're having today and building that awareness so that we're ready to serve the individuals who really need it most at this time.
I think what it's done as well as from just an organizational standpoint is that we talk about how we've learned how to be much more flexible. Not that we were, but boy, and I think everybody can say that. And we always joke about, oh, that's nothing. Back in 2020, when we had the pandemic, we anticipate saying those types of things. But I really think seriously, it's just given us an opportunity to add more tools in our toolkit, for lack of a better word. People can, and with that, we're talking about telehealth, those types of things. People can use it from wherever they are. They can come into the office. We have more offerings that you can do. And our prevention education team did a fantastic job creating videos and presentations so they could do virtual. If they couldn't be there, they could show the programming. The teacher could use it to reinforce some learning. Those things are never going to go away now. So we've actually added more ways of work, as I'm sure everybody in every industry is going to say that too. So that's, I guess you hate to say, oh, something good came out of pandemic, but I think that did. I think that really taught us to be a little more idea generation, because sometimes I think you just kind of get stuck in the way you do things and it's working.
So if anyone from the audience does have any questions, you can either raise your hand or put it in the chat box. But I'm also glad that we were able to have this conversation just to be able to bring awareness and give insight on how your agencies have been impacted. So I appreciate you all for being here.
Well, thank you for having us. And again, I apologize, I was a little late, but it's great to see all of you. And if you have any questions, you think of something afterwards, feel free to email.
Absolutely, yeah. I agree. Thank you.
Yes, thank you. And please feel free to reach out, email, give us a call at Reach. We are happy to help.